Good evening, Ms. Harrison. How are you?
I'm good. How are you?
I'm doing well. My name is TCole, and I'll be your nurse this evening. And I just finished looking over your patient questionnaire, and I want to come in to sit down and talk with you, okay?
Okay.
Okay, tell me what brought you in today.
Um, well, I had surgery 2 months ago. I had a DNC, and since then things just hadn't been right. I hadn't been eating at all. My nails, they've been real brittle. They're not growing. My skin is real dry. It's real itchy. And plus, I'm still having some abdominal bleeding some of the bleeding that I was having prior to
When
having
was your
surgery.
last cycle? What day did it start?
Actually, it started 2 weeks ago.
Okay.
And I'm still having some, I guess you would call some breakthrough bleeding because I have some spotting in between.
Okay. Alrighty. Okay, and you said you had a DNC.
Mhm.
And do you remember the date of your DNC?
No, ma'am.
Okay,
I just
but
know
you
it was
said
2 months ago.
2 months ago.
Mhm.
Okay, so that would have been in May. Okay. Besides the irregular bleeding, do you have any past medical history, any medical problems?
Anemia and high blood pressure.
Anemia. Okay, you got those down. Any history of diabetes?
No, ma'am.
Okay. Tell me about your medicines.
I take HCTZ 12.5. I take that a day.
Okay.
I take lisinopril 20 milligrams. I take that a day.
Okay.
I take an iron tablet. I'm supposed to take it 3 times a day, but I only take it twice.
You take
And
it.
yes, ma'am.
Mhm.
And then I supposed to be doing a B12 shot, but I don't do those because I don't like shots.
You don't like shots. Okay. Did the doctor tell you why he wanted you to take the B12 shots?
No, he just told me it'd be something good for me to do, but
Okay.
I don't.
And it's probably because of the anemia. It's the reason why he wants you to take that. So,
Oh, okay.
but we'll try to get you a little literature on that and talk with you more before you leave. Okay.
Okay.
What about your diet?
I haven't been eating anything since I had the surgery. I just haven't had any appetite.
Okay. Poor appetite.
I might eat maybe 1 or 2 meals a day, maybe.
Okay.
I eat a lot of ice. Yeah. I drink sweet tea sometimes a lot, and I drink Diet Coke.
Okay. And that ice, typically when people are anemic, they crave ice, and that doesn't help the anemia. So.
Yeah.
Okay. And again, like I said, we'll discuss that after we finish. Okay.
Okay.
Do you have you noticed any rashes or eczema, psoriasis, any type of skin lesions?
No, ma'am.
Okay. Do you have any broken areas anywhere on your body that you've noticed?
No,
Any
ma'am.
broken skin, okay. Have you noticed any type of skin changes?
No, ma'am.
Nothing at all, okay. Alrighty, what I need to do now is we're gonna perform just a general overview of your skin.
Okay.
Also, we're gonna look at your hair since you're saying you're having some breakage, and also at your nails, and we'll go ahead and do that and get started, and then we'll let Dr. Scott come in to see you, okay?
Okay.
All right, I've already washed my hands. I'm just gonna get a little bit of this sanitizer. And what I wanna do first, I just kinda wanna look over your skin just to make sure everything is consistent with your color. There's no hypo or hyperpigmentation. And basically what I mean by that, there's no lighter areas versus some darker areas and things like that. What about any changes? You notice any changes with any moles?
No, ma'am.
No changes with the moles, okay? Like I said, I just want to look here. I'm just going to raise you down a little bit. I just want to look at your legs. Okay. That's good here. Okay. And I'm just going to look at your back as well, okay?
Okay.
Just to make sure. Okay. Don't see any discoloration on your back either. Okay. All right. Now what I want to do, Ms. Harrison, I just want to assess your skin, okay?
Okay.
First thing I want to do, I just want to assess your skin for the moisture. Have you noticed any oiliness? I know you told me that you have some dryness, but what about any excessive sweating or diaphoresis?
Just sweating, yeah.
Sweating?
Mhm.
Okay, and that's been since the DNC as well?
Mm-hmm.
Okay. I just want to feel your arms. Don't feel any moisture right now. Just gonna look on your arm here. Doesn't look like you're perspiring. Okay. Let's look under this arm for. Okay. Don't see any excessive perspiration. Okay. Now I just want to check the temperature of your skin to see how it feels. I'll just use the back of my fingers. Okay. Feels warm and dry. Okay. I just want to feel down here as well. Okay, and I'm going to feel your back as well, okay? want to feel your skin for the texture of your skin. Do I feel any roughened areas, or is it smooth? Feels pretty smooth to me. Just gonna feel your arms. Is the room temperature okay? I see you got some.
It's okay.
Like you got cold here, according to your skin.
It's okay.
Okay. Okay. Just gonna feel down your legs. Alrighty. What I'm gonna have you to do now, Miss Harrison, is to lie back, because I want to check the turgor and the mobility of your skin, okay?
Okay.
Because a lot of times when we check the turgor and the mobility, it can let us know if you're dehydrated. I know you said that you're not drinking a lot, but you are eating the ice. I'm gonna let your head back just a little bit, okay? In just a minute. And what I'm gonna do, I'm gonna grasp some skin here under your clavicle, your collarbone here. I'm gonna grab the skin and see how easily it rises, and that just tells us the mobility of your skin. And then I'm gonna let it go to test the turgor to see how elastic your skin is, okay? And it looks pretty good, okay? Okay, I'm gonna just do the other side to check as well. Okay, I don't see any tinning, and what I mean by that is that as soon as I release your skin, it goes back to its original position, okay? Let me look at your hands here. I want to just see if I see any calluses. I don't see any calluses. What type of work you do?
I work at a convenience store.
Work at a convenience store? Okay. I'm going to look at your knees as well. Sometimes, have you had any itching to your knees? No itching to your knees? Just rotate this just a little bit, okay? Sometimes if you have a lot of itching on the knees, it can get roughened, feel kind of leathery, but I don't feel that, okay? Feel smooth. Don't notice that. And while I'm down by your legs, we're going to check for fluid, okay? I'm just going to take my thumb and I'm going to press it on here on your legs and also on your ankles for about 3 to 4 seconds to see if it leaves an indentation. And if it does, that lets us know that you are retaining some fluid, okay? Just going to check your ankles. Okay. Don't see any indentation. That's a good sign. And now we'll do it here on your legs. Okay, I don't see any indentation there, so that's a good sign. We're not retaining any fluid. I tell you what, while we're here, I'm going to go ahead and assess your feet. Okay? And what I need to do, I'm just going to look between your toes just to make sure you don't have any broken areas. You told me no family history or no personal history of diabetes, right?
Right.
Okay. All righty. Just give me a moment. Move this table out of the way. Okay, just come over here. Just going to separate your toes. Between them, okay? No discharge or drainage between your toes. Okay? Your nails are not, got a little polish on them, but I can see a little bit. But have you noticed any yellowing of your nails? No. No yellowing before you polished them, okay? You don't have any, I didn't see any cracks or breaks. Any history of athlete's foot?
No.
Anything like that? Okay. Alrighty. What about your nails here? Are they breaking? Are they brittle, or is it just your fingernails? Your toenails break too? Okay, but they're, okay. All right, I'll be sure that we document that, okay? Now, cover your back up. Now, do you have any mold anywhere?
I have one on my neck, but it's been there for forever.
Okay, well, let's just check it, just to be on the safe side, okay? You said it's been there?
Oh, yeah, it's been
Have you noticed any changes with that
No.
mold? Okay, I'm just gonna lower your head just a little bit. I didn't realize it was so late. Okay, just gonna let the rail down. Get you just to turn your head a little bit over here. Okay, I see it. This is the one you're talking about here? Okay, see the edges of it is smooth. It's even all the way across. Doesn't appear to be raised either. And the color, have you noticed any color change? No color change? Okay. Has it gotten larger in size?
No, ma'am.
Okay. I'll be sure to mention that to Dr. Scott because we're concerned about moles because you have to worry about melanoma. And anytime there's a change in that mole, we try to teach patients about the ABCDE of melanoma. We want to look at the asymmetry of it to make sure that everything is normal with it, that it's even. We want to look at the border to make sure the outer edges that it's regular and smooth, that's not irregular. We want to look at the color. A mole should be consistent in its color all the way across. It shouldn't be lighter in one area and darker in another. The diameter, has it gotten larger over time? If it starts to enlarge, that's something that needs to be brought to a physician's attention. And also the evolution of it. Is it changing? If it's rising, okay? But that looks okay. But again, I'm just the nurse, not the doctor, but I will let Dr. Scott know about that, okay?
Okay.
Give me just a moment. And okay, Ms. Harrison, we're going to just do the part of your assessment now pertaining to your nails, okay? All righty. Just want to look at your nails, looking at your cuticles. Your cuticles are intact. I know you said that they were brittle and breaking.
Mm-hmm.
Okay.
They were.
So were they a lot longer before the surgery?
They were.
They
felt
were?
like yours are.
They were.
Yeah, they were. Yeah.
Okay. All righty. Your nail base is firm. Okay. Your nail beds are pink. See this hand here? Smooth. I don't feel any indentations or any grooves here, but I do notice that you have a bow line.
Why? What's that?
That's just a line that sometimes when you injure the nail bed, have you injured your nail on this finger?
I did that.
You did that, okay. All right, well, like I said, that's smooth otherwise. Do you, like I said, if you drink some water, that could possibly help your nails as well. And they're splitting?
Yeah.
They're splitting and they're brittle, okay. One other thing, I want to look at the edges to make sure that they're clean, they're smooth and they're clean right now. I understand that you're saying that they may be splitting. Let me just check your capillary refill, okay? That's about 3 seconds, okay? Now, let me see your index finger.
Why?
Okay, I just need to look at your index finger because I want to check the nail on your index finger because I want to make sure that you don't have a lot of excess curvature or it's not excessively flat, because if it is, that tells us that you've been deprived of oxygen for a prolonged period of time and clubbing occurs. Okay, Ms. Harrison, the last part of our exam, we just need to look at your hair, okay, to check your hair. I'll have you to lean forward, okay? And what I want to do, I just want to look at your scalp, okay? And you said you've been having some breakage?
Yes, ma'am.
Is there any particular area where you've noticed the breakage, or is it just in general throughout?
In general.
Okay? Okay. Don't really notice it here. Okay. Now just also, I was looking to see if you had any moles on your scalp, any type of lesions. Have you noticed any type of lesions or any drainage?
No, ma'am.
Okay. Any excessive itching to your scalp?
No, ma'am.
Okay. Alrighty. And let's just check the texture of your hair. It does feel a little dry. Okay. Yeah, I can see with me just doing that, I noticed that it's breaking a little bit. Okay. Alrighty. Now, I just want to feel your scalp for any type of depression, to see if I feel any. Let me know if this hurts, if it's tender, as I'm doing this, okay? Any discomfort?
No, ma'am.
Okay. One other thing that I really need to do, when we were checking, I need to make sure that in checking for I need to check to make sure to look at your mucous membranes, to make sure that they don't look pale, because sometimes if you're dehydrated and, like I said, the changes with your diet, you may have a little bit. Okay?
It's a little warm in here.
Okay. Let me just look in your mouth. Okay. Don't see any breakdown there. Throw that away. And I want to look at your conjunctiva. Okay. Don't look bad. Okay. All right, Ms. Harrison, just a few things that I would like to go over with you, and then Dr. Scott will come in and talk with you. Do you ever assess your skin, do a full skin assessment?
Sometimes.
Okay, it's a good idea, practice to assess your skin monthly, to stand in front of a full-length mirror and to assess your body front and back. You may have to get a hand mirror to look at your feet, stand behind a mirror and to look just to see that you don't have any breakdown or any type of discoloration or broken areas in the areas that are hard to see. As far as the foods, I've got you a list here that will help, that are high protein foods that will be good for you. Things like chicken, seafood, those are types of foods that are helpful for you, okay? That will help with the protein. If you increase the protein in your diet, it could possibly help your hair growth. It'll minimize some of that hair loss, okay? Another thing is taking your iron. It'd probably be best for you to take it the way the doctor has prescribed it, and he may want to give you a stool softener that'll kind of help with that constipation. If you're taking with the tea, drinking tea and taking iron, the tea makes the iron not work, okay? So you may want to limit the tea until you get your iron counts built back up. And it's a good practice, 64 ounces of water a day, and that's 8-ounce glasses a day. That'll help your hair, that'll help your skin, that'll decrease some of the itching, all that will help, okay? And the ice is gonna facilitate you being anemic, so we may want to alleviate the ice. Okay, I'm gonna go ahead and get Dr. Scott and he can come back and finish, and we'll be back shortly, okay?
All right,
Thank you so much. You have a good day.
Yes, ma'am, you too.
Okay, bye-bye.
Bye-bye.